Did you know? Hi, and welcome to this week's episode of Did You Knows. This week is our first opportunity to respond to a subscriber who's requested a topic to be covered. So this week we're going to cover nosebleeds. Nosebleeds in medical language is called epistaxis. I don't know why we always have to have so many different words in medicine that cover different topics, but nosebleeds, epistaxis, it's the same thing. So what's happening when you get a nosebleed is some sort of blood vessel has broken open inside of our nose, and typically it's going to come out the front. We have blood vessels throughout all of our nasal cavity and our sinuses too, and any of these are going to be vulnerable, but the spot that is most likely to bleed is actually only about this deep inside of your nose along the septum, which is that structure in the middle of our nose. The fancy name for this area is called Kesselbach's plexus, but you don't really have to worry about that. So you find yourself or a loved one or a friend with you has a nosebleed. What do? So the first thing to do is that you want to actually be leaning forward. So by leaning forward, what you're doing is actually allowing the blood to come out the front of the nose and preventing it from going backwards. If it went backwards, the clots that form can actually fall down and can actually choke you. So we want the blood to come forward. Second step, we want to pinch our nostrils. So pinching hard enough. And when you pinch so hard, you actually will occlude or compress the blood vessels, and you're going to prevent the blood from actually flowing or dripping out. So you'll know that you're doing a good job if you're leaning forward and compressing, and there's actually no blood that's coming out. The next is that we need to actually hold pressure for anywhere from 10 to 15 minutes. Holding pressure gives those blood vessels an opportunity to clamp down and all of the important clotting factors and platelets to start to work so that they can actually stop the bleeding. If we keep checking, so pinch for a couple seconds, check, what we're doing is we're just opening that clot back up and the bleeding will continue longer. Once you've leaned forward and been pinching and holding for about 15 minutes, then slowly and gently just let go. If the bleeding has stopped, the next step in management is keeping that clot nice and moist so that it doesn't break up. Using something like a saline nasal spray is really helpful to dissolve that clot and prevent sharp edges from creating a new cut inside of your nose. If it's still bleeding, at this point, I would consider going to the emergency department to see if there's any sort of compression that they can provide that would help. If this is something that happens once and no additional nosebleeds are occurring, no problem. If this is a recurring issue, your first step for intervention would be to try to moisten the inside lining of the nose by applying something like a saline gel, or you could put a thin layer of Aquaphor or other nasal ointment inside of your nose. This should fix the problem within a couple of days. If it doesn't, then it's time to get into your friendly ENT doctor and have them take a look. If you have any other questions about this topic or any other topics, please feel free to leave them in the comments below. Otherwise, I'll see you next week on Did You Knows? Did you know?